The first thing I'll ask you, so how long had you been smoking for before you came in here?
15, 20 years.
15, 20 years?
Well, more like a social smoker. I went through a period where I was maybe a couple packs a day, but very short period. So, a good 5 years I've been steadily smoking, maybe a pack. It got to a pack a day, actually.
And then,
so I knew that I needed to do something.
Yeah. And then you came in here and...
I did, but not for that reason.
Oh, really?
Yeah, I just read some literature, and I thought, oh heck, I'm going to try it. I thought it was kind of hokey, but I tried it. And actually, I went out of here, and I went and smoked. When I first went out, my father died, so that gave me a reason, you know, you pick up the cigarette. So then was shortly after that, I didn't like the taste. I didn't like it. Thought, what the heck is going on here? Didn't like the smell, the taste. I actually didn't like, I was kind of forcing myself to smoke, and I didn't like it. It was just kind of strange. Yeah. So I don't know if it was a carryover from that, and this whole positive energy and blowing it out. I'm like, oh, baloney, you know. But I do believe it. I think there was something, a whole lot to it.
Yeah.
I think I quit smoking.
Yeah.
And I don't know why. So it all kind of just worked.
Yeah. What procedures did he do?
He did the
auricular therapy. That's what it's called.
He had some gems.
Okay.
That and then
crystal therapy.
Yes. That was it.
Okay.
Therapy.
Yeah.
What other one do they do? And I could have come back, but I didn't really have to.
Yeah. So after that, you just
stopped.
Have you smoked since?
I had a cigarette, but I haven't really smoked. No.
Yeah.
Because my sister smokes a lot, and my sister-in-law, and you know when you're in their company, that's usually when you'll smoke. You know, if there's other. I don't really have a desire for it anymore, and I want to smoke sometimes, just social, but it doesn't really taste good to me.
Yeah.
So that's my story.
And so, what'd you come in here today for?
For my back pain, and I have a lot of arthritis, and just so he uses electrostim. Today he did that chin chew or whatever it was.
Qigong.
He did that. It did feel better. Whatever the heck. You breathe in, breathe out, you know, and it kind of warmed the area. Because I came in, like I couldn't really do that.
Really?
I know you don't believe me.
No, he's done stuff on me too.
I don't believe me that actually, because I was like a 5 or a 6, and I'd had my pain medication. He does treat me with my pain medication along with my therapy, which I was like suffering so much when I just happened to walk in here one day because I live in Florida, so I'm back and forth all the time. But I've kept him as my pain management doctor, and he's kind of done a few things.
That's awesome.
Yeah, he really is. And I'm kind of, each time, a little...
Yeah. A little bit more of a believer each time. Yeah,
because I had so much kind of, I was a little hesitant and like, oh yeah. But I am more of a believer.
Yeah.
So I feel good about it. So actually, he's helped me with my back. He's got a back brace. My foot, they want to do surgery on it, and they want to do an ankle replacement. And I've kind of been, not dragging my feet about it, but it's kind of handicapped me in a lot of ways. And I don't really want to do the replacement. It's kind of a radical surgery.
So he's been helping you with that?
And I just happened to mention that to him because it's been giving me a lot of trouble. So he did that little thing.
Qigong.
Yeah. And so the thing is, the medication for my back and the treatment for my back has kind of like worked. I've had less pain with my ankle, my back kind of with the electrostim, and I've gotten just to be a little bit happier person. When I first came in here, I was just miserable.
Yeah. That's great.
So I think with the combination, you know, of the medication, the treatment, the back brace is wonderful. I wear that. And I can't believe all these years, no one's ever suggested that.
Yeah.
I mean, because I broke my back, I was 45, so just a vertebrae. But I mean, it went, and then I just have a lot of arthritis, basically.
Okay.
But
so he's just helping you live happily.
It just, to have a certain quality of life. I was getting, like, very depressed and stuff, because I was so limited. I know doesn't look like much, but it really affects your lifestyle.
Yeah, I bet.
And anyway.
All right. Well, that was good.
So